Hello, I'm Dr. Tim Shaver of Arthritis and Rheumatology Clinics of Kansas. We have been in practice since 2001. I've been in practice in Wichita since 1994. This practice was started because we felt a need to have a specialty-specific rheumatology practice in the region that was focused solely on treating these diseases. We had, at the very beginning of our inception of this practice, the goal of providing quality care in a compassionate and efficient manner for patients suffering from rheumatic disease, and really had the goal of relieving pain and suffering, but also optimizing people's lives and their function. And that's really been our passion here at Arthritis and Rheumatology Clinics of Kansas. We treat many diseases that are inflammatory in nature. I think the best summary of what a rheumatologist does is we treat inflammation. And that can involve many conditions that we see. Many of them involve the joints, but they also involve different parts of the immune system. So obviously we treat rheumatoid arthritis. That's a big focus of what we do here. We treat lupus, we treat gout, we treat psoriatic arthritis, other conditions such as ankylosing spondylitis, other autoimmune diseases such as Sjogren's syndrome, scleroderma, different forms of blood vessel inflammation known as vasculitis. So we treat really a wide variety of things here. Some of them involve other organ systems in addition to the joints. But we are passionate really about providing care for these disorders that really do often require someone who has a focus in this area. Many of them are very complicated. They require some updated and advanced therapies, and we are poised to do that. To get an appointment here is by referral, mainly because we like to have that correspondence with the referring physician and be able to communicate with those offices. So that's something that if your primary care doctor feels the need to have that referral take place, we are very glad to see you at that point, and we will make sure that we communicate to the referring physicians. We would definitely want to give them input, and we will determine if this is a condition that we need to continue following long term, or if this is something we can make recommendations and send back to the primary care physician to delegate that responsibility to them also. So we look forward to seeing you, and we thank you for those of you who have placed your trust in us and who will place your trust in us in the future.